Get Covered Jax. You've heard me talk about this a lot over the last couple of months. Open enrollment ends in just a matter of days, and this allows you to make the choice on how you want to keep your family and yourself healthy. And the last day to enroll or make changes for 2024 is coming up. It's Tuesday, January 16th. It is extended one day because of the MLK holiday on Monday. Now, if you enroll now, your coverage will start almost immediately on February the 1st. Dr. Sunil Joshi, Chief Health Officer for the city of Jacksonville, joins us. You know, we've had telethons where we've had people calling in and answering phone calls and answering your questions. And also the city has dedicated a lot of energy and resources to get people enrolled as soon as possible. And honestly, Dr. Joshi, it's been eye-opening for me to see the amount of people who don't have health insurance, what they are able to get for low cost or even no cost depending on their income.
Yeah, I mean, I think it's been this effort has been amazing, and we need to thank Channel 4 for partnering with us in this. But we started this back in November with 120,000 people here in Duval County who are uninsured. And in the first month, we were able to decrease that number by 22%. 26,000 people signed up just by understanding that it could be an easier process if you just get people to help you with it.
You know, I think one point that really stuck out to me, the mayor, when she launched this in the news conference, was that people, if you don't know, you don't do what's right for your family. So this whole thing was about education. That's why we did partner with the city.
That's right.
You have any stories where people have just saved a ton of money?
Yeah, and you know, what the mayor always says is a confused mind says no. And that's exactly what we have learned through this process. My favorite story is of this 32-year-old woman, single mom of two children, who for the last 2 years had no health insurance and wasn't able to get her asthma medications or her diabetes medications, and would end up going to the emergency room to get treated when she would have exacerbations of her conditions. She learned about our program, got hooked up with one of our navigators who went through her income and some of the plans, and she realized that a plan that she thought she would never be able to afford, which would be about $100 a month premium plan, she was qualified for subsidies that brought that plan down to about $320 a month. So a significant decrease. She was able to sign up for that plan, get into preventative care, now has her asthma managed and her diabetes managed as well, and feels like she can take care of her kids again and not worry so much about herself as she used to previously.
And that's really the key here, is that preventative care, you know, being able to get those routine tests, those routine checks to make sure that nothing gets to the level where you do have to end up in the emergency room.
Yeah, and I think that's one of the misconceptions as we talk about health insurance, is people don't realize that they feel like, okay, if I'm paying $300 a month for this, I'm still going to have to pay for that blood test that screens for my cholesterol or my colonoscopy or my pap smear or my flu shots. And that is not true. If you have marketplace health insurance, those preventative services are covered for you at no cost.
And I think another misconception sometimes we hear is that if they do uncover something, if I do have a problem, how am I going to pay for the care that's needed? So it's better off that I don't know, because I won't be able to do anything about it. But this insurance allows for that, with even being able to see a specialist for less than $10 in some cases.
Depending on which insurance plan you get, your copay could be significantly lower than what you had originally thought. And the whole idea here is preventative care. So we don't want people to use the emergency room as their preventative care, because that's not really the job of the emergency room. The emergency room is to treat you and get you out. You want to get healthy enough so you don't have to go to the emergency room. And that's where the primary care physicians come into play. And with a program with health insurance, you're able to at least get that preventative coverage at no cost.
All right, we could talk about this all day, and we have been talking about it for several weeks now. But the key here is people can connect with an expert and find out their specific case, what they will pay based on their income, based on their family. And then if they want to make a decision, they can. If they don't have to, but at least get that information. Talk about those navigators.
Yeah, I mean, I think that's an important piece. That's the most important piece of this whole thing, is that it is confusing if you don't have someone to help you. And so if you go to getcoveredjax.gov, you'll see on there listed navigators, volunteers, a volunteer assistance program, and private insurance brokers. There's a link for each of those. Click on them and it'll take you to a different link where you can look for some folks who may be able to help you. And these folks will go through the process with you step by step and make it as painless as possible, and then follow through with you to make sure that you are paying your premiums, that you are going to see your primary care doctor. All of that is important to keep you on track to staying healthy.
Dr. Joshi, I love that point, because, you know, many of them came in to answer the phone calls, and I listened listened to them and they cared.
Yes.
I mean, they were all about getting that lowest price, making it affordable for your family, and then making sure that you knew how to use that coverage to the best of your ability. All right, so that deadline is coming up. If some of this just said, I need to at least do the research, Get Covered Jax. You'll be able to get all the information you need. You can sign up to talk with a navigator over the phone to see if there is a plan that is perfect for your family. Thanks for coming in again.
Thank you, and thank you for everything you guys have done for the program.
No doubt.